good evening, Madam Sharda Jain and dear friends. We now come to the second session, which is truly a very unique and very touching session where stalwarts, where our very famous, well-known gynecologists are going to reveal their hidden secrets so that we all can learn from their experiences. It's truly an experience, a case of unity and sisterhood. So the first case is by Dr. Sonal Bhatla, who is the president of DGF Civil Lines. She is a real crusader against breast cancer, and she's going to tell us about AAP BEETEE, khud ki jubanee. Over to you, Dr. Sonal Bhatla.
Thank you very much, Dr. Devya, for this opportunity. First of all, I must congratulate ma'am for an lucid lecture, which was pointing to addressing the important points of documentation in clinical practice. Now I present my case. This was a 26-year-old primary gravida, a booked patient with no known antenatal complication. She presented in early labor, was augmented after due consent with syntocinon. She went into active labor 12 hours later when an ARM was done. Patient requested for epidural analgesia, which was given after proper consent. The progress of labor was uneventful. About 9 hours of labor, she had an episode of desaturation up to 88%. The vitals were normal. Oxygen was supplemented, on which the symptoms of desaturation and breathlessness, they reversed. Without any delay, opinion was taken from physician and in-house anesthetist. She was fully dilated with headed perineum. With a view to avoid maternal distress, forceps-assisted delivery was conducted after consent. Live baby delivered, mild PPH, which was managed with drugs, and episiotomy was stitched in layers. Patient was fine. The saturation was around 95% that time. The relatives informed about the incidents, and the episode was recorded, and the signature were taken from the husband, and the husband was made to see the wife also. 1 hour post-delivery, patient again had an episode of desaturation up to 77%. She had tachycardia and BP was normal. She was breathless. A diagnosis of amniotic fluid embolism was made. Physician was again called in immediately. Patient was given Solimedrol, put on Venturi mask, low molecular weight heparin was started. Portable X-ray chest was done and hematological investigations were sent. Patient's husband was counseled again, and again the signature were taken. Patient was shifted to ICU, was evaluated by chest physician, senior anesthetist, and cardiologist. The echo showed tachycardia. A transabdominal scan was also done, which was normal. Antibiotics were upgraded. Meanwhile, it was found that the D-dimer was positive. The relatives were counseled by physician and chest physician. Consent for BiPAP followed by elective ventilation were taken. Despite best efforts, patient developed DIC 3 hours post-delivery, went into ARDS, and had cardiac arrest 6 hours post-delivery, and expired in spite of prolonged cardiopulmonary resuscitation. Postmortem was advised, which was refused by the relatives. So, a case summary with attached references suggesting grave outcome associated with amniotic fluid embolism was submitted in the Delhi Medical Council. Now, this case is still on, but few important points I would like to highlight at this platform. Document whatever you tell to the patient and relatives during labor and get it signed. Every 4 hours, if you are assessing the patient, please let the relatives sign whatever you write on the case sheet. Please make him sign whatever you are telling him. Adequate informed consent for each procedure should be given. The informed consents have recently been introduced by the FOXI. I think they are very helpful. Never hesitate to call for help. Involve multidisciplinary team in a high-risk patient. Always take negative consent for postmortem. Now, in court of law, prepare your reply yourself and get it edited from a lawyer and your company, and always submit references along with the literature. All members of team should submit the same reply. Hire your personal lawyer and take a good indemnity insurance. Take guidance from your seniors whom you trust. Must attend a course on medical legal issues and keep listening to webinars pertaining to them. They make you sensitive to medical legal implications in clinical practice. That's all I would like to say.
Thank you so much, Dr. Sonal. Really thankful to you for giving us this piece of your experience. Very important case. Dr. Shardajan, ma'am, would you like to comment on it, or should I proceed to the next case?
I think what I want to just tell you is that her good documentation is going to save her. She's almost saved. Okay. Dr. Raj, you want to speak? Another case?
So, yes.
This is my case.
Dr. Raj.